everybody. Karen Roby here with Neeraj Gunsinger with Byte. We're glad to have you here with us today here on TechRepublic and ZDNet. Of course, we've been talking a lot about Neeraj, about the ways that companies across this country, across the world for that matter, are trying to step up to find a way to help right now. And you guys, I know typically on a normal day, you are providing at-home invisible aligners for people, and of course in the orthodontic market. But now you're shifting gears a little bit while still keeping an eye on that business and trying to help here in this crisis situation that we're in. Talk a little bit about what you guys are doing when it comes to the 3D printing and how that's going to help our frontline healthcare workers.
Great, thanks for having me. So, about a week ago, the executive team got together and, realized that we needed to do our part to fight this crisis. So we very quickly looked at our manufacturing capacity, both in Ardmore, Oklahoma, as well in California. And we spoke to our, supply chain folks, and we realized that we could shift a certain amount of our 3D printers out in Oklahoma to focus on a couple of things. One was airway parts for ventilators. So our head of manufacturing out there sent us some images and videos of the 3D printing process to get the airways. He actually showed us a finished product. And so we're kind of looking through what the demand is, what the need is when it comes to ventilator and ventilator parts, and prioritizing those parts that are in most demand based on what we can actually print. We're making sure that we're still focusing on our core business as well. We just added on printers to be able to do this. We're doing very well as a business right now, so to be able to carve out a little bit of time and space and facilities, manufacturing capacity, it seemed like the right thing to do. In California, there's a combination of a low-tech version and a high-tech version, right? So the low-tech version is our head orthodontist out in California had been getting a lot of demands, well, not demands, but questions from local ER doctors and nurses about air shields. And so we very quickly realized that we could actually pivot some of our human resources, buy from local suppliers, be it Home Depot, be it whatever, and put together home shields very quickly on a low-tech basis, and provide 10, 15, 20 to the local hospital, and then work hospital to hospital in our local community out here in California. But what we really wanted to do is prove out to the country and the world that even the little things you can do, if you think about it as scale, over 10 million companies, 5 million companies, 100 million families, whatever it may be, if you can provide one shield, two shield, masks, whatever you can do, if we bring that in scale and provide it out to the ecosystem, it'll be a really big win for the entire country.
Yeah, and I like that, that you guys, obviously as the president of the company, the leader of the company, you're trying to set that tone and hoping, that obviously your employees see the value and catch on with that, but not just them, also the community at large, trying to set an example and hope that they will follow your lead as well. Talk to me too before we jump off here, Neeraj, about telemedicine too. This is something that obviously has been around for quite some time, but we're talking about it a lot as doctors and dentists and everyone is having to stay safe and talk to their patients for the most part through a computer screen. How are you guys doing that? How is it helping patients at home?
So our product, what's great about our product is an at-home invisible teeth aligner system, which consumers can do from their home. So they'll get an impression kit, they'll take a mold of their teeth, they'll send it back to us, and we very quickly send them out a digital scan of their teeth. It shows the imperfections and shows how an aligner system can help them work. In order to do that properly, we had to build out an entire teledentistry platform, meaning the local dentist, the local orthodontist in the state that puts together the plan and the treatment is able to communicate with the at-home consumer about their entire treatment plan. That was focused on Byte consumers only. And so we've been growing, like I said earlier, like nearly 1,000% year over year, very profitable. But what we decided to do about 2 weeks ago is we knew that there was thousands, tens of thousands of dentists and orthodontists that offices shut down. But consumers or patients that were going through treatments still needed to communicate with those doctors and dentists, or just had general questions about their oral care. We opened up that platform very early on to the entire country for free. And since we've done that, we've had thousands and thousands of patients kind of check in with our network, have questions, and we try to turn around those within 24 hours, giving access to our entire dental network to answer those. And then our chief cosmetic officer, Dr. John Marashi, he goes on Instagram and then he answers some of the, the most common questions through his stories on Instagram, which has been very powerful and providing comfort for, the entire country when it comes to their oral care needs.
Very good. And I think, just staying connected, we keep saying it, but on every front, staying connected to each other is certainly how we're going to get through this. And it's going to take all of us working together. And it certainly sounds like all of the folks there, part of your company there at Byte, Neeraj, are doing their parts. We certainly appreciate it. Thank you so much for being here with us today. Definitely a different setup than we're used to as we're working from home and some crazy times here. But again, we appreciate you all being part of the solution as we work towards this. Much more on our coverage here on TechRepublic and can be found on ZDNet as well. Thanks for watching, everybody.